dehydration is much more than just the loss of water. In fact, this lack of awareness around the symptoms of dehydration leads to a condition called silent dehydration, not knowing that one is dehydrated to some extent. It affects millions worldwide and is especially common in India with its hot and humid climate. 2022 was one of India's hottest summers ever, with an unprecedented 280 heat wave days. And in 2024, India has been reeling under the longest spells of recorded heat wave in many more parts of the country. The UN has forecasted that 2023 to 2027 will be the warmest 5-year period ever recorded, making more people vulnerable to dehydration. So what is silent dehydration? How do we identify it? What should we do to manage silent dehydration, and how do we treat it? How serious can it get? To discuss all of this, we are joined by Dr. Sumit Bhatia, Senior Consultant Gastroenterologist, Paras Health, Gurgaon, Clinical Nutritionist and author Ishik Khosla. She's also the Founder President of Celia Society of India, Dr. Preeti Thakur, Head of Medical Safety Sciences, India, Restorative and Digestive Health, APAC, Kenview. Thank you all so much for joining us on this very, very critical issue. To begin with, Dr. Bhatia, I think the first thing, if you can tell our viewers and if you can explain to us what really is silent dehydration, how commonly is it experienced, and also if you can tell us what are the symptoms.
Dehydration simply means that body does not have enough water or fluid, what it needs to perform its functions optimally. So now dehydration is a very well recognized medical term. So any dehydration which is getting missed, we take it as undetectable or silent dehydration. Now, traditionally, dehydration has always been associated with diarrheal illnesses. Yeah. So whenever any person is having vomiting, any person is having diarrhea, we say the person has dehydration because he's obviously losing fluids. The silent dehydration also comes in a number of other conditions or number of other physiological ways, in certain populations where it is much more common and goes totally unrecognized. So every fever, any kind of a stress on the body, any kind of illness, age groups such as young children, elderly age group. So these people have dehydration, which most people will just get overlooked. Yeah. They just will not realize that they are dehydrated, because traditionally dehydration is only described in medical terms during an episode of diarrhea.
So more for patients. Yeah.
More for patients, yeah. So how do we recognize it? So we have to be watchful. As a physician, you have to be always on the watch out for subtle signs of dehydration. What are the symptoms of dehydration? So, in profuse dehydration, a person will feel thirsty, person will feel extremely fatigued, they will have generalized weakness, they will have dryness of mouth. Signs when a person walks into us, we see that, what is their overall look like? How is their pulse rate? Whether it is fast, whether it is slow, whether they are looking dehydrated, how is the skin pinch feel, what is their eye feel, what is their skin color. Those are the signs and symptoms of dehydration. But unfortunately, these things also will come in later stages. Most of us drink water when we feel thirsty. Now, thirst is our go-to signal for drinking more water. But in elderly, this mechanism is highly deranged. And some of them will not feel thirsty till a very, very late stage when they are completely dehydrated. Okay. So the whole idea about dehydration is that it will not come only in the medical terms. The patient should not reach my office or my clinic to feel that, it is dehydrated. There are subtle signs like headache, feeling extremely fatigued, having lack of energy. Those are the signs and symptoms one should look out for.
So, Dr. Khosla, now that we know what silent dehydration is, Dr. Bhatia has explained that really well, and we know the symptoms as well, as a nutritionist, how does it impact the overall well-being, and how should we be tackling it?
It can become a serious condition, and it can also lead people to, just fainting and collapsing without knowing what's really going on, because like Dr. Bhatia said, thirst is not a reliable indicator of our fluid needs. And very often, not only among the elderly, even youngsters, I feel many of us who do not feel thirsty enough or don't drink enough, or on the other hand, drink too many dehydrating fluids. So they don't realize it, cups of tea and coffee keep happening during work days without your realizing, or even alcohol for that matter. And the wrong food, very, heaty food, too much of meat and too much of processed food. So the wrong kind of diet can also lead to dehydration, too much of salt, without your knowing that, it's something connected to fluids. The first thing is to take fluids. And when I say fluids, I'm not only meaning water, but I mean fluids with electrolytes. And in general, I would say in summers with the temperatures that are all around us, I just feel drink more than eat. So if you improve your overall selection of food, avoid too much of caffeine and alcohol and meats and spicy food, and give your gut a little rest. So because when your body is under stress, your microbiome is also working hard. So give it a little relief by not eating or not eating too much. And that also helps to prevent these kind of conditions.
So being mindful of what you're eating, and like you rightly said, different kinds of fluids as well.
Yes.
In fact, Dr. Thakur, I want to come to you here. And Dr. Khosla also mentioned about electrolytes. Of course, it's good to have water, but like she said, adding something in the water. You have done a lot of research on fluids, electrolytes, as well as energy. Take us through that. I mean, what really interested you to get into something like that? And how does this really help in tackling the issue of dehydration, specifically silent dehydration?
Thank you for the question. Actually, if you see conventionally, dehydration is associated with diarrhea because there is a lot of loss of fluid as well as electrolytes,
yes,
and becomes really critical to be managed as well. However, when we were going through the published literature, it was coming up very strongly that in patients with conditions like fever, including tropical fevers, general weakness, heat-related illnesses, vomiting, respiratory tract infections, there may be some underlying dehydration. Why? Because these patients were also losing a lot of fluids. In addition to it, because of the illnesses, there was loss of appetite, due to which the patient is consuming less. So increased losses associated with or without reduced intake may land up the patient with dehydration. And this dehydration may have an impact on recovery of the patient. This was further as well corroborated when we worked with an expert multidisciplinary panel of clinicians across India that yes, there is dehydration in these conditions. Along with dehydration, because the patient is not consuming enough amount of calories, there may be an energy deficit as well. So deficit of fluid electrolytes along with energy is having an impact on the recovery of the patient.
Okay.
If I have to give you an example, for a patient with fever, 102 degrees centigrade, the patient is actually losing about 900 ml of fluids in 24 hours. And there may be an additional loss of about 90 ml through the respiratory secretions. The ASPEN, which is an international association, American Society of Parenteral Nutrition, has emphasized on hydration and nutrition along with the appropriate management for that particular condition, and they do recommend adding certain fluids with calories or recommending water in addition to clear liquid fluids, which is providing this hydration, electrolytes as well as energy that is critical for working of a body. Okay. And this is something which really interested us, and therefore we went into discovery, or we went into the research for this particular therapy area.
Okay, that's interesting to know. And also it's so critical, like we're talking about it. Dr. Bhatia, when patients come to you, or if I can ask you that, in your clinical experience, what are the kind of people you see who come to you? Is it with dehydration? Is it more acute illnesses? If you can tell us a little bit about that as well.
So almost all the categories which you mentioned. So acute illnesses, so I'm being a gastroenterologist, we see a lot of acute illnesses which can have significant fluid losses like pancreatitis, liver diseases. We also see a lot of diarrheal illnesses. There are certain age groups, like Dr. Preeti rightly pointed out, even a simple condition like a viral illness or a viral fever, with every degree rise of temperature, person starts to lose more fluid. The requirement actually goes up. But when you are having a fever, running a fever, your appetite goes for a toss. Your thirst goes for a toss. The thirst signals become impaired. So people will stop taking more fluids. And in fact, whatever little they are supposed to take, they are not even taking that. So that predisposes them for dehydration. Now, these things get manifold compounded in certain age groups like children. So children, very young children, they are unable to communicate. They cannot express, they cannot say thirst. So it affects their crying, it affects their urine color, it affects their urine output, it affects their mood. Elderly, again, most of the elderly, the thirst, as I said, sometimes is impaired. Yeah. So they don't feel thirsty. Now, if they're running a fever, they're not drinking enough. Plus, they are on certain medications which can, make them lose more electrolytes. You know, like so most of them, these patients will be on blood pressure medications which have diuretics, with the drugs which increase the urine output. They lose sodium, they keep on losing potassium. They are running a fever. Now they are not drinking enough, and suddenly, you know, they will be completely dehydrated. They can have completely altered sensorium. They can become unconscious, and that's how some of the patients are, you know, brought in to us in the emergency room, thinking that, you know, something really bad has happened. And when it's a simple thing which could have been taken care of, you know,
At
well
home,
in
yeah,
time.
You're more conscious of how much,
Diabetics, you know, we have one of the largest population of diabetes in this country. Now they, in general, are very prone to get dehydrated. So dehydration is something which we have to constantly keep reminding us that we have to drink water. Youngsters, you pointed out, in this kind of a weather, are all youngsters drinking adequate water? They are doing, you know, most of us are health conscious now, so most of them are going to gymnasiums, doing strenuous exercises, but are they keeping themselves hydrated? You know, that's a question. A normal individual, we say that, you know, minimum of 2 liters to 2.5 liters of intake of fluid should be there. You know, when a person is exercising, the requirement will go up. Are we matching that up? Remains, again, you know, unexpressed. During fever, how many of the physicians are actually pointing it out to their patients that, you know, keep yourself hydrated?
Yeah. So it's not just that pill, but you must remind the patient to have enough water as well.
Exactly.
Or,
Yes.
or like
Not
keep
only
yourself
water.
hydrated. In fact, that's my next question to you, Dr. Khosla. You know, we were talking about the senior citizens or the elderly. We're talking about children. In fact, I want to ask you this. Recently, last week, a 17-year-old boy, you know, he got out of a swimming pool, and you think you're in water, you know, your body temperature is cooler, and unfortunately, he lost his life. You were telling us about, you know, I think something when enough water is not enough, right? I mean, some other fluids as well. Can you tell us what else can one take besides water to help tackle dehydration?
Fluids, water with some kind of salts and electrolytes and minerals added to it is the best way to hydrate. To answer the question on what could have happened to the boy who lost his life, typically you also lose a lot of magnesium in sweat, in body fluids. So whether it's through your urine or through your sweat, you are losing a very critical mineral which is important for heart function and the heart rhythm. And I think today with the kind of food that we are eating, with the kind of absorption that we have with the leaky gut that we are all talking about, and with the excess focus on protein and protein supplements in gyms, we are certainly depleted of this nutrient. And perhaps this boy was, you know, that what happens in the pool is insensible sweating. We don't realize that you are losing fluids. And that could have been one of the, you know, factors which could
and probably
lead
he
to
was not having enough water because he's thinking or something
and
to
you're
drink.
not thirsty, or you're not thirsty. So I think these are good learnings for everybody today. And like rightly said, this is going to be the case. You know, high temperatures are going to be around for a while. So we really need to prepare our population because we haven't
I think we need to make the people aware. These are very small things, like you rightly said, when Dr. Bhatia said it, when you said, you know, people don't know. I mean, it's something small, but if you're mindful about it, if we are keeping ourselves hydrated, whether it's water or whether it's ready to drink or even making something at home, coconut water, I think that's critical. Dr. Preeti, I wanted to ask you, you know, since you've also, besides we've spoken about electrolytes, what about energy? What role does that play when it comes to dehydration?
So we all know that, you know, energy is required, which is going to keep us going. So it's required for our daily activities. At the same time, it is also required for our body metabolism. In the conditions which we spoke earlier, for example, a patient with fever, there is loss of appetite, the patient is going to consume less. In addition, in these conditions, the body metabolic requirement goes up, so the caloric requirement is also going up, because of which the body may land up into deficit. So on one hand, there is increased requirement of energy. On the other hand, there is reduced intake. The body can get into energy deficit, which can again further have an impact on recovery for that particular patient and slow down the process of recovery. So therefore, in one of the publication, Indian expert panel is actually recommending for non-diarrheal conditions from day one, it is advisable to recommend fluid, electrolytes and energy, which has an impact on recovery or fastens the process of recovery. So therefore, energy becomes very, very critical. At the same time, even if we consider about from an hydration perspective, for hydration as well, water, yes, water to be consumed, but water may not be enough. So we also need optimal amount of sugar along with electrolytes, which helps in faster absorption. So that's where as well energy plays an important role.
So definitely, well, on that note, we're going to be taking a really short break. Don't go anywhere because we're going to be talking about this very critical issue, silent dehydration.
मिलेगा या नहीं ये आपके क्रेडिट स्कोर पे डिपेंड करता है। तो आज ही पैसाबाजार.com पर जाइए और अपना क्रेडिट स्कोर चेक कीजिए फ्री में, क्योंकि लोन की जरूरत कभी भी किसी को भी पड़ सकती है।
बस एक्टिंग करा लो इनसे।
पैसाबाजार.com, क्रेडिट स्कोर चेक, आदत अच्छी है।
मूविंग नेक्स्ट, बिकॉज हम गैजेट्स की बात कर ही रहे हैं, लेट जस्ट गो बैक टू द मोस्ट कॉमनली यूज्ड गैजेट दैट वी ऑल हैव इन आवर पॉकेट्स, द स्मार्टफोन। और अगर हम इसको एनालाइज करें तो आपको लगता होगा दिस इज जस्ट अ डिवाइस टू प्ले गेम्स, वॉच सम कंटेंट, या फोन पे बात कर लो या टेक्स्ट कर लो, बट यू नो व्हाट, there's a lot happening behind the scenes because this small little device is packed with multiple sensors. हो सकता है आपने सुना होगा about accelerometer या gyroscope कि कैसे ये sensors काम करते हैं। जब आप अपनी गैलरी में किसी फोटो देखते देखते जब फोन को रोटेट करते हैं तो फोटो रोटेट हो जाती है, all thanks to accelerometer। या फिर जैसे आप जब गेम्स खेलते हैं तो how you can use some gestures, all thanks to gyroscope। बट इसके अलावा in a standard smartphone, normally we have from 15 to 20 different kinds of sensors working round the clock to make sure कि जो आपका experience है वो बहुत अच्छा हो जाए। I'll give you a few examples. For example, we have the proximity sensor. ये सेंसर स्क्रीन के ऊपर यहाँ लगा होता है एंड बेसिकली द आइडिया इज टू डिटेक्ट कि क्या आपका फोन आपके चेहरे के पास है या नहीं है। सो व्हेन यू पिक अप अ कॉल एंड पुट द फोन नेक्स्ट टू योर फेस, द स्क्रीन गोज डार्क, या फिर जब आपका फोन पॉकेट में होता है द स्क्रीन गोज ऑफ एंड बैटरी कंज्यूम नहीं होती है। सेकेंड सेंसर इज द एम्बियंट लाइट सेंसर, जो कि आपके फोन में ऑटो ब्राइटनेस के लिए काम करता है, बिकॉज इट एनालाइजेज व्हाट्स द एम्बियंट लाइट इज एंड उसके अकॉर्डिंग आपके स्क्रीन की ब्राइटनेस को एडजस्ट करता है। नेक्स्ट वी हैव अ बैरोमीटर। आपको लग रहा होगा बैरोमीटर का फोन में क्या काम है? यू नो व्हाट, इट्स ऑल फॉर द एल्टीट्यूड एंड ये हेल्प करता है पेयर्ड विद जीपीएस टू गिव यू अ बेटर एक्यूरेसी एंड बेसिकली वेदर एनालिसिस।
Welcome back. So we're in conversation with Dr. Preeti, Dr. Ishi and Dr. Bhatia, and we're talking about how we could beat silent dehydration. Dr. Bhatia, you know, now when we, of course, we're in the peak of summer, has been tough, heat waves, and monsoons also we see are longer. So when we talk about the bout of dengue, malaria, that's also much longer. Now with the onset of these fevers, how should one be coping with those, or how can one tackle that? Because in the process of recovery, what we've been talking about.
So that's a very, very important question. So as I earlier pointed out that, you know, any kind of fever will make a person lose more water. With every degree rise of temperature, there is extra 10% consumption or loss of water, which goes silent and undetected. So fevers like dengue and chikungunya, which are, you know, we are in a tropical country, unprecedented summer wave, so monsoons are not going to be better. So these illnesses are going to crop up in our country. And dengue especially, you know, we have certain guidelines. The first 4-6 days, the hydration part is extremely, extremely important in management of any kind of fever, especially dengue. So dengue, chikungunya are viral illnesses. We don't have specific medications for that. So it's extremely important for a patient to keep themselves hydrated. They may not feel thirsty, but they will have to keep maintaining their hydration status. They may not have diarrhea. They may only have some mild abdominal discomforts, but that does not mean that they stop eating or stop drinking. See, we have to understand why there is so much of emphasis on oral rehydration. Our intestines have an inherent capacity that they always absorb glucose along with water. So sodium, glucose, water, they get absorbed.
Yeah.
This combination is extremely important while a patient is running a viral illness like dengue and chikungunya as well. So I cannot emphasize that more than that.
Okay, yeah. So to maintain the balance, these three are extremely important.
Yes.
Okay, Dr. Preeti, what steps are you taking, to advance the science behind tackling or beating silent dehydration?
So being pioneers in this area, we look forward to continuing the work with the multidisciplinary panel of expert key opinion leaders or clinicians across India. At the start of the year, Association of Physicians of India, they have released the expert consensus recommendation on how do you really manage oral fluid electrolytes and energy for hospitalized patients while transitioning them from IV to oral. In this month itself, by Journal of Association of Physicians of India, there is a supplement which has been released which focuses upon hydration as well as recovery. And this article also captures the importance of replenishing oral fluid electrolytes and energy and what is the impact on the recovery for a particular patient. There's an interesting article in that supplement which talks about hydration and immunity. So it's known that dehydration can have an impact on the immune response. So how does the dual role of addressing hydration and supplementing the minerals which are helping in having a supplemental effect on the immune response? And that's where we look forward to, continue our work in addition to the special population, where we'll get further into it.
Okay. So, we've spoken about a lot today. I mean, I think we've all learned. I definitely have learned a lot, and hoping our viewers have also, got this knowledge. But talking about awareness, I mean, these are small things which are doable. This is, I could say, is in our hand if we know about it. Dr. Ishi, could you tell us, how could more awareness be done on something so critical like this?
I think what we are doing today, having more and more discussions in the media, and also addressing the more vulnerable populations like the children and the elderly. It's important to share the signs and symptoms that can happen. The typical things like a dry mouth or a simple headache should not be ignored. And we've all been through it. I think each one who's here has been through some amounts of, some degree of all this, in presentation. And so this minor symptoms and of course the major symptoms also to look out for, and look at blood pressure and high heart rates among the elderly. So just simple things which can be out there in the media, through the media and through social media. I think that would go a long way, and I think what we are doing today is a reflection of that.
It's definitely the beginning.
Yes.
And quickly, the closing comments, an advice, Dr. Preeti, I'll start with you, that you would want to give our viewers to beat or fight silent dehydration.
I would recommend consider replenishing fluid, electrolytes and energy to beat silent dehydration.
Dr. Bhatia?
Don't wait to get thirsty. Keep drinking, sipping something. Only water may not be enough. You need to replenish your energy and electrolytes as well. And whenever you are not feeling well, whenever you are sick because of any illness, not only diarrhea, please be on a watch out, especially for your hydration. That actually will smoothen and fasten your recovery.
Dr. Khosla?
Watch your digestion, watch your gut, and watch your food. And make sure that your food includes a lot of fluids. And simple plain water may not just be enough. So, and also plan your day with respect to your food and your fluids.
Well, it's been an absolute pleasure to have you with us on NDTV. Thank you all so much. So clearly, there is more to hydration than just drinking water when one is thirsty. Electrolytes and nutrients make water more effective as a remedy for dehydration. Remember, you may be dehydrated and not even know of it. But now you know what to watch out for and how to address silent dehydration. Stay hydrated, stay healthy. Thank you all our guests, and thank you all so much for watching.